محاضرتنا هو Puberty. Introduction. The primitive gonad is fair evidence at 5 weeks of embryonic life and form the medial aspect of mesonephric ridge. Undifferentiated gonad has the potential to become either testis or an ovary. Paramesonephric duct later will form the Mullerian system and the precursor for female genital development. The lower end of the Mullerian duct will fuse in the midline to form the uterus and upper vagina. The upper vagina, most of upper vagina is from Mullerian tube in origin, while the lower vagina from sinovaginal bulb. Primordial follicle containing oocytes are rest in a prophase and surrounded by granulosa cells separated by basement membrane متكونة من اللايدك cell. Maximum number of primordial follicles is reached at 20 weeks gestation and this is reduced by atresia throughout the childhood and adult life. هاي معلومات نحتاجها على مود نقدر نفتهم شنو ممكن changes physical changes which occur during and after puberty. Normal puberty is a process of reproductive and sexual development, a maturation that changes the child into adult. خلال childhood الhypothalamic pituitary ovarian axis وهذا الhypothalamic pituitary ovarian axis اللي hypothalamus اللي هو produce GnRH which التارجت مالته هو pituitary for production of FSH and LH and the target is ovary to produce estrogen of progesterone. This axis is suppressed شوكت at childhood and the level of GnRH, FSH and LH are very low. From age of 8 to 9 years, GnRH started to secrete impulsation of increasing amplitude and frequency. And this initially, these increment initially sleep related. But as puberty, كل ما puberty progress, these extend throughout the day. And this stimulates secretion of FSH and LH from the pituitary and which in turn trigger the follicular growth and steroidogenesis where in the ovary. The estrogen produced by ovary راح يسوي initiation of physical changes of puberty. The exact mechanism determining the onset of puberty is still unknown, but it's influenced by many factors as race, heredity, body weight, and exercise. Leptin plays permissive role in the onset of puberty. Physical changes, which are called secondary sexual characteristics, that occur in puberty are breast development, which is known as thylacine, and the pubic and axillary hair growth are known as adrenarche. Then we have growth spurt and menstruation, known as menarche. First physical sign of puberty are breast budding. This is occur 2 to 3 years before menarche. يعني breast budding راح يكون about 2 to 3 years before onset of menarche. Appearance of pubic hair is depend on secretion of adrenal androgen, which is usually occur after thylacine. In addition to increased level of adrenal and gonadal hormone, growth hormone also secreted from pituitary gland also increase, and this will lead to pubertal growth spurt. Mean age of menarche is 12.8 years. And it may take over 3 years before menstrual cycle establishes. a regular pattern. Cycle initially usually anovulatory and can be unpredictable and irregular. Initially at first time of menstrual onset, it is anovulatory. Absence of menstruation is known as amenorrhea. At Tanner stage, it is pubertal development described by Tanner and the stage of what? Of breast and pubic hair development is referred to Tanner stage. هذا Tanner stage from 1 to 5. يعني Tanner stage هو used to describe breast and development. هذا هو Tanner stage. هنا يقسم breast development وهنا هنا يقسم pubic hair development وهو من 1 إلى 5. Precocious puberty شنو definition مالتها؟ هو onset of puberty before age of 8 in girl or 9 in boy. يعني starting of secondary sexual characteristics earlier than normal, and it is classified either to central or peripheral. الcentral is GnRH أو نسميها gonadotropin dependent central precocious puberty, and the etiology either it's unknown اللي هو most common idiopathic نسميها. طبعا هذا الإيديوباثيك unknown لازم احنا نسوي exclusion to all causes of precocious، وإذا ما لقينا cause نقول عليه هذا idiopathic. CNS malformation, CNS tumors or CNS infection. البريفرال precocious puberty اللي هو gonadotropin independent and it's always pathological وممكن تصير by estrogen secretion. مثل إيش؟ يعني استروجين ممكن exogenous ingestion أو hormone producing tumor مثل adrenal tumor or ovarian tumor that produce estrogen. نجي على investigations. radiographic bone age. هنا نسوي اكس راي للبون نشوف قد الستيج الواصل للفيزيال بليت كلوجر، نقدر نحدد من عندها الايج. هنا سيرم FSH LS استراديال and TSH level, pelvic sonography, MRI of CNS and contrast medium, GnRH stimulation test. كل هاي test in order to assess cause of precocious puberty. Treatment of central precocious puberty احنا شغلتين عندنا: prevent short adult height and limit the psychological effect of early pubertal يعني development. فاحنا شنو نعطي هالبيشنت؟ GnRH agonist. هذا ايش راح يسوي؟ down regulation of pituitary gland، فراح يسوي inhibition of FSH and LH release from pituitary. GnRH هو agonist، هو يشبه GnRH. بالبداية راح يسوي stimulation of pituitary، راح يزيد بالبداية FSH LH، لكن بالاستمرار وبهاي دوز راح يسوي لنا down regulation of pituitary وراح يسوي لنا inhibition of FSH and LH release from pituitary. فلذلك احنا التارجت مالت ال FSH وال LH قلنا هو الأوفاري، فالاستروجين والدروب and there is marked regression of what breast and uterine size. إيش وقت إحنا نسوي discontinue لل GnRH agonist؟ تقريبا at age of 11 years على مود ال patient recontinue her normal puberty. Regarding the treatment of peripheral precocious puberty is correction of the underlying cause. Delayed puberty. Puberty considered delay if no secondary sexual characteristics are noted by age of 14 or if the males have not commenced by age of 16. يعني شنو؟ يعني البيشنت إذا هي age 14 years old and there is no secondary sexual characteristics is regarded or considered as delayed puberty. And patient when is 16 years old and has secondary sexual characteristics but there is no menstruation started yet and is also considered as delayed puberty. Causes of delayed puberty. أول شي عندنا constitutional اللي هو physiologic delay يعني ما عندنا pathological disorder. Number 2 عندنا chronic anovulation polycystic ovarian syndrome. هنا بالchronic anovulation صاير وقت صاير before onset of puberty فالبيشنت هنا على الأكثر عندها secondary sexual characteristics لأنه PCOS patient has an estrogen لكن not started menstruation yet. Number 3 anatomic cause as imperforated hymen, transverse vaginal septum, vaginal and or cervical agenesis. Number 4 androgen insensitivity syndrome. And number 5 hypergonadotropic hypogonadism. يعني شنو؟ يعني عندنا هنا defect in the gonads. لما يصير عندنا defect in the gonads يعني in the ovaries راح يصير عندنا increase in the FSLH to stimulate but there is no response and so it's known as hypergonadotropic hypogonadism. يعني هنا الهايبرجونادروبيك إذا سوينا measurement لل FSHLH راح نلقاها high لكن استروجين يكون قليل as in gonadal dysgenesis as internal syndrome, pure gonadal dysgenesis as 46XX or 46XY يعني هو سواء كان male أو female بس هو gonadal dysgenesis. A pure gonadal dysgenesis. A premature ovarian failure يعني ovarian failure وش وقت يصير before onset of puberty. Number 6 hypogonadotropic hypogonadism يعني defect عندنا وين بالCNS CNS etiology يعني احنا إذا نجي نقيس FSHLH نحن نلقى له as in tumor craniopharyngioma infection trauma hypothyroidism hyperprolactinoma psychosocial as eating disorder excessive exercise stress or depression. Constitutional delay is the most common and this adolescence lack of both secondary sexual characteristics and pubertal growth spurred by age of 14 مثل ما قلنا. Probable cause delay in reactivation of GnRH pulse generator. بهاي الحالة إنه patient may start on low dose of estrogen until puberty progress and it is not necessary to introduce progesterone. Now another object is disorder of sex development. In order to know or to get an idea about disorder of sex development, we should know some information about gonadal differentiation. Here, estrogen expression, estrogen is found on Y chromosome, and this is responsible for testis determining and known as testis determining factor. This will lead to presence of estrogen due to the development of testes from undifferentiated gonad. And this will lead to differentiation of testes into Sertoli cell and Leydig cell. Sertoli cell produce AMH which is anti-Mullerian hormone. شنو الفانكشن مالته؟ هو involution of paramesonefric duct اللي هو Mullerian duct يعني inhibit formation or development of paramesonephric duct اللي هو Mullerian duct. اللي قلنا هو شو يسوي لنا الموليريان داكت؟ يسوي لنا اليوترس fallopian tube cervix and upper vagina. Leydig cell will produce testosterone. Testosterone, it will lead to target of testosterone is Wolfram duct, and this will lead to formation or differentiation of male internal genitalia as epididymis and vas deferens. Testosterone also acts on dihydrotestosterone. This potent testosterone, this will lead to virilization of external male genitalia and formation of penis and prostate. So, the disorder of sex development is a condition where the sequence of events described above doesn't happen. يعني إحنا بأي جزء من هذا ال differentiation of the gonads there will be a defect, there will be, so a result is disorder of sex development, and the clinical consequence depend on within the sequence of variation occur. And this disorder of sex development can be detected at birth اللي هو يكون على شكل ambiguous genitalia or abnormal genitalia, or the detection may be done at puberty in girl اللي هي عادة presented with the primary amenorrhea or increase in virilization. نجي نقسم ال disorder of sex development into three classes: sex chromosome disorder of sex development, and 46XY disorder of sex development, and 46XX disorder of sex development. Regarding first class with the sex chromosome disorder of sex development, here we are, the disorder is in the sex chromosome, so it's either 45 هنسميها XO which is sterile syndrome, or 47XXY and is known as Klinefelter syndrome. Or here we have 45XO and 46XY which is here known as term mosaic, and this will lead to mixed gonadal dysgenesis, or 46XX and 46XY, and this will lead to ovipositive disorder of sex development. High regarding what sex chromosome disorder. Here we have 46XY disorder of sex development. يعني احنا الكاريوتايب هنا XY. ف testicular development عندنا disorder فايذر it's or هنا either testicular development disorder or androgen production or action disorder. اوكي فهنا بالtesticular development يعني هو there is المفروض اكو testis لكن there is pure gonadal dysgenesis or يعني partial gonadal dysgenesis or ovipositive or testis regression. Regarding androgen production or action disorder, either androgen synthesis disorder, androgen receptors disorder, LH per HCG receptors disorder, or anti-Müllerian hormone production disorder. Regarding 46XX يعني هنا كاريوتايب هو 46XX، لكن عندنا disorder of sex development. شلون؟ either ovary developmental disorder يكون على شكل of testicular gonadal dysgenesis، أو على شكل androgen excess اللي هو source ممكن يكون fetal or maternal or placental androgen excess. هنا ناخذ فد example على الكروموسومال disorder of sex development اللي هو Turner syndrome. هنا الkaryotype of Turner syndrome is 45 and it is a result from complete or partial absence of one X chromosome, and this will lead to 45XO karyotype. It is most common chromosomal anomaly in female and occurs about 1 in 2,500 live female birth. Also, mosaic karyotype is not uncommon and leads to variable presentation. The most clinical features of Turner syndrome مثل ما نشوف هنا هو short stature، هنا عندنا web neck، wide spacing nipple، هنا عندنا cubitus valgus، and also there is a medical disorder as coarctation of aorta and renal system anomalies as Harshaw kidney, and also there is bicuspid aortic valve. And in this patient, patient with Turner syndrome, ovaries are not well completed and developed, so only stroma is present, and so the gonads are called citrate gonads. And also, of course, they are not functioning and cannot produce estrogen or oocyte. نجي على الدايجنوسيس ممكن يكون at birth، ممكن يكون at early childhood، ممكن يكون at adolescence. at birth and early childhood from clinical appearance of the baby أو short stature خلال فترة childhood or diagnosis is not maybe in about 10% till puberty اللي patient presented with delayed puberty. وبما أنه ovaries not produce estrogen, so there is no secondary sexual characteristics present. زين نجي على treatment. In childhood treatment should be focused on growth by giving growth hormone. Adolescents focus on puberty. In this case or internal syndrome pregnancy is not possible only with ovum donation لأنه البيشنت الwoman internal syndrome he has normal uterus. Psychological support also is important. In mosaic girl clinical picture طبعا be wide variety. ممكن normal puberty وmenstruation ممكن occur لكن there is early cessation of period and secondary amenorrhea develop. نجي على ال other class of disorder of sex development اللي هو misgonadal dysgenesis. زين هنا الكاريوتايب maybe 46XX لكن عندنا XX per XY mosaicism is present up to 20%. In this situation إيش راح يصير عندنا functioning ovary and testicular tissue. So this condition is known as ovipositive disorder of sex development. زين الاناتوميكال finding هنا بهالحالة vary حسب الفانكشن مالت الجونز. يعني إذا كانت بهالحالة إذا كانت التستس if the testis is functional بهالحالة if the testis is functional so the baby will be fertilized. And have ambiguous genitalia or normal male genitalia. لكن Mullerian structure usually absent on the side of the functional testis. فلذلك ايش راح يصير عندنا unicornuate uterus وين in the ovary or in the citrate gonads. ليش؟ لأنه at the side of testis اللي هو لما تكون هنا التستس هي functioning راح يكون عندها or there is a Mullerian inhibitory factor which inhibit Mullerian duct development. So no Mullerian duct. لكن at the site where the testis is non-functioning or presence of ovary or streak of gonads ما عندنا Mullerian inhibitory factor. So there is no Mullerian inhibitory factor, and Mullerian duct was developed as unicornuate uterus. نجي على 46XY gonadal dysgenesis، يعني هنا الكاريوتايب هو XY 46، لكن عندنا gonadal dysgenesis. هنا الجوناز not well developed into a testis، المفروض هي developed لكن not well developed. ليش؟ despite the presence of XY carrier. This is due to mutation in the SRY gene on the Y chromosome. يعني احنا SRY gene موجودة على Y chromosome لكن اكو mutation، فراح يصير عندنا disorder in function. فإذا عندنا complete gonadal dysgenesis ونسميه Sawyer syndrome، الgonad remain as a streak gonad, so does not produce any hormone. لكن anti-Mullerian hormone is absent. So the Mullerian structure do not regress and the uterus, vagina, uterus, cervix and upper vagina, fallopian tube develop normally. يعني احنا هنا هو XY karyotype. الgonads is dysgenetic, so there is no anti-Mullerian hormone, so the Mullerian duct will develop. لكن absence of testosterone معناته الفيتوس not virilized. زين بهالحالة ايش راح يصير؟ الفينوتايب هو female، لكن الكاريوتايب هو XY chromosome اللي هو male، لكن الجوناد non functioning and presentation. هنا presentation يكون شوكت at adolescency with delayed puberty. زين dysgenetic gonad has high malignancy risk, so they should be removed when diagnosis is made. And in such case, a puberty may be induced with estrogen. هنا نجي على other 46XY disorder of sex development اللي هو نسميه complete androgen insensitivity syndrome. هنا الفيتوس with complete androgen insensitivity syndrome testes form normally. okay by effect إن هو karyotype هو XY هنا by effect of SRY gene. طبعا إيش وقت تبدي function at appropriate time at time of puberty and AMH secreting, and this will lead to regression of Mullerian duct. So women do not have uterus. Testosterone also produced from the testis لكن inability of androgen receptors to respond. إيش راح يصير عندنا external genitalia not virilized and instead undergo female development. فإذا الفينوتايب راح يكون female لكن الكاريوتايب هو male، والتستس هي functioning produce androgen، لكن المشكلة وين؟ المشكلة بالreceptors for androgen. بما أنه ما عندنا androgen receptors non-functioning فالvirilization ما راح يصير عندنا. Baby is born with normal female external genitalia and absent uterus, and testes are found somewhere in the line of descent through the abdomen from the pelvis to the inguinal canal. احنا قلنا at embryonic life التستس will migrate from the abdomen toward the inguinal canal، فممكن التستس راح نلقاها in this pathway. زين usually presentation يكون at puberty with the primary amenorrhea. presentation هو تكون احنا قلنا الفينوتايب female لكن female with amenorrhea. ليش with amenorrhea؟ لأن هي أصلا have no uterus. gonadectomy هنا is recommended. ليش due to risk of testicular malignancy. vagina is usually short. ليش؟ لأنه إحنا قلنا المولاريان داكت يسوي لنا الأبر فاجينا، لكن اللور فاجينا فما موجودة. اللور فاجينا from sino-vaginal bulb origin, and treatment will be required to create a vagina عن طريق surgical vaginal reconstruction operation. يعني هنا بالإكس واي female due to androgen insensitivity الفينوتايب هو female، كاريوتايب هو male، التستس هي functioning and develop and produce androgen، لكن الديفكت بالreceptors for this androgen and that will lead to invirilization, and so the presentation at birth هو female. At puberty has a delayed puberty. نجي على other disorder اللي هو also XY disorder اللي هو alpha reductase deficiency. Fetus is XY karyotype. The testes are functioning and produce testosterone and AMH. AMH يعني شنو؟ راح يصير aggression of Mullerian duct. لكن testosterone هنا unable to convert to dihydrotestosterone. احنا قلنا dihydrotestosterone اللي هو potent testosterone اللي هو يسوي لنا virilization of and development of and differentiation of external genitalia in the peripheral tissue. So no cannot virilize normally. فpresentation هنا الpresentation راح يكون على شكل ambiguous genitalia at birth, but also be with increasing virilization at puberty or female child. يعني هو female يعني either presented as ambiguous genitalia or he female and increased virilization at puberty. Why? Because of functioning testes, and testes develop or secrete androgen due to large increase in circulating testosterone at time of puberty مثل ما قلنا. It's usually assigned to be a female sex of rearing, but there have been description of a few communities إنه تحولوها transition from female to male gender at puberty is accepted in communities. نجي على ال 46XX disorder of sex development. هنا يعني الكاريوتايب هو female، لكن هنجي نشوف الفينوتايب شنو راح يكون. طبعا most common causes of 46XX disorder of sex development هو congenital adrenal hyperplasia which lead to virilization of female fetus. هنا عندنا enzyme deficiency when in corticosteroid production pathway بالادرينال gland. يعني هنا عندنا المشكلة البروبلم بالادرينال gland due to deficiency of 21 hydroxylase enzyme. هذا الهيدروكسيليز انزيم احنا هنا ايش راح يسوي لنا الفانكشن مالته انه convert progesterone to deoxycorticosterone and 17 hydroxyprogesterone to deoxycortisol. The reduced level of cortisol produce drive the negative feedback and lead to hyperplasia of adrenal gland, which leading to excess of androgen precursor and then elevated testosterone production. هنا نشوف هذا الدايجرام اللي هو steroidogenesis عندي adrenal gland in congenital adrenal hyperplasia female. There is deficiency of 21 hydroxylase enzyme. The action of this enzyme is conversion of progesterone to deoxycorticosterone and then to aldosterone production. Also, 21 hydroxylase converts 17 hydroxyprogesterone into 11 deoxycortisol and then to cortisol. and when we have a deficiency in this enzyme, so there will be no production of aldosterone or cortisol. This will lead to negative feedback on the hypothalamic pituitary axis, and this will lead to more stimulation of adrenal gland, and adrenal hyperplasia will result. So the adrenal gland started to increase the precursor production for aldosterone and cortisol. And when 121 hydroxylase deficiency is present, so there will be shifting of this precursor toward the production of testosterone. This testosterone will lead to virilization of this female. So the woman is karyotype is 46XX and presented with virilization. زين raise androgen level ايش راح يسوي لنا virilization of external genitalia, clitoris enlarge, labia are fused, and تكون scrotal in appearance. 2/3 of children with 21 hydroxylase عندهم مشكلة ثانية اللي هو salt losing. This also affect ability شنو احنا to produce aldosterone مثل ما قلنا احنا to affect aldosterone and cortisol. This is life-threatening situation, and children who are salt losing often become dangerously unwell within few days of birth. هنا the treatment for congenital adrenal hyperplasia require lifelong steroid replacement such as hydrocortisone, and surgical treatment of genitalia is considered. Now we have another object which is Mullerian anomalies. Mullerian anomalies is occur up to 6% of female population and may be asymptomatic. Etiology unknown, although is associated with, and it may be associated with renal anomalies and present about 30%. يعني patient with Mullerian anomaly there may be association with renal anomalies. هنا there is several classification used. classification هنا عندنا خلينا نشوف على الدياجرام. احنا first class نسميه hypoplasia or agenesis، طبعا هو segmental، may be either vaginal or cervical، يعني cervical hypoplasia or agenesis fundal يعني in the fundus or tubal or combined يعني أكثر من segment عندنا disorder بيه. class 2 اللي هو unicornuate uterus. unicornuate uterus معناتها عندنا defect or disorder in development of one of Mullerian duct. احنا قلنا احنا عندنا pair of Mullerian duct, two Mullerian duct fused and form the uterus onto fallopian tube. هنا بالunicornuate uterus عندنا disorder in development of one tube, Mullerian tube, and so this will lead to formation of unicornuate uterus. The other tube either become rudimentary horn, and this rudimentary horn with cavity which communicate with endometrial cavity, or a rudimentary horn with cavity but not communicating with the cavity, endometrial cavity, or rudimentary horn without cavity at all, or there is absence of rudimentary horn at all. Usual presentation here: infertility ممكن يكون endometriosis, and if pregnancy occur may have premature labor or malpresentation fetal growth restriction, and maybe also cesarean section. نجي على الكلاس 3. كلاس 3 هو يوتراين دايدلفي. احنا قلنا على مود يصير عندنا يوترس and fallopian tube لازم يصير عندنا fusion of both uterine tube. هنا باليوتراين دايدلفي there is failure of fusion of uterine Mullerian tube. So this will lead to formation of two uterine cavity and two cervix. So this is known as uterine didelphi. والتريتمنت ممكن يكون by surgical by metroplasty. Class 4 عندنا bicornuate uterus. هنا bicornuate uterus عندنا disorder in fusion، يعني هنا أكو fusion but there is a defect. The fusion is not complete. فهنا احنا عندنا either complete unicornuate يعني هنا two cavities and these two cavities either communicated as partial or non-communicated as complete bicornuate uterus. Also هنا treatment is by surgical intervention and as metroplasty. نجي على الكلاس 5. كلاس 5 اللي هو septated uterus. هنا صار عندنا fusion of two uterine tube، لكن المفروض ورا الفيوجن يصير reabsorption of this median segment. هنا ما صار عندنا reabsorption، فهذا السبتم either يكون complete بحيث يفصل إنه two cavities or تكون partial small septum. Also treatment surgical by metroplasty. Arcuate uterus هنا عندنا فد يعتبر as mild type or minimal type of Mullerian duct anomalies. And final class اللي هو diethylsterol related Mullerian anomaly وراح يسوي لنا T-shape uterus. إذا نجي نحكي على Obstetric Mullerian اللي هو class 1 ممكن يكون transverse vaginal septum, cervical agencies or imperforated hymen. هنا presentation يكون على شكل cyclical abdominal pain or amenorrhea. Why? Due to accumulation of menstrual blood. presentation ممكن يكون at birth as mucocolpus or hydrocolpus or maybe at puberty and smooth common. على شكل hematocolpus بيكون patient presented with cyclic pain, amenorrhea, abdominal pain mimicking يشبه acute abdomen, and there will be maybe associated with difficulty in urination or defecation. Treatment by surgical incision of hymen and drainage of retained blood. هنا حكينا عليها longitudinal vaginal septum unicornuate uterus, uterine dilatation and bicornuate, septated uterus and arcuate. هنا unicornuate uterus. هنا hysterosalpingogram وبين هنا عندنا unicornuate uterus. هنا هذا الهيماتوكولبس بحالة الامبرفوريتد hymen إنه يصير عندنا accumulation of the blood in the uterus. هنا عندنا transverse vaginal septum. transverse vaginal septum طبعا ممكن يكون at different level. accordingly. هنا هذا هم unicornuate uterus. هنا different type. هنا uterine didelphi. Here is bicornuate. هنا عندنا septated uterus complete and partial. وهنا unicornuate uterus. هنا uterine didelphi. هنا عندنا two cervix, two uterine cavity. هنا longitudinal vaginal septum. هاي هنا عندنا 3D ultrasound. هذا المنظر by hysteroscopy. هذا septated uterus. هنا septated. هنا partial. هنا complete. هذا gross. هذا bicornuate uterus. هذا gross. هذا hysterosalpingium. واللي هنا تنتهي محاضرتنا. وإذا عندكم أي استفسار أو سؤال ممكن تطرحون إياه على الكلاس روم. وشكرا.